Let's now discuss diarrhea and its Western differentiation. In Western medicine, diarrhea is defined as the passage of 3 or more loose or liquid stools per day, or an increase in the number or volume of bowel movements. Acute diarrhea starts suddenly and lasts less than 14 days, whereas chronic or persistent diarrhea is defined as a symptom that lasts longer. From a pathophysiological perspective, diarrhea may be subdivided into osmotic, secretory, inflammatory, and motility related. The causes of acute diarrhea. Major causes of acute diarrhea include various viruses like the rotavirus, bacteria like the Salmonella, Escherichia coli, and parasites like Giardia lamblia, which can cause gastrointestinal infections. In addition, it may result from ingestion of toxins, use of drugs like antibiotics and chemotherapy medicines, inflammatory conditions such as appendicitis, and mesenteric ischemia. The most common causes of chronic diarrhea are irritable bowel syndrome, celiac disease, chronic inflammatory bowel diseases such as Crohn's disease and ulcerative colitis, and neoplasm. In more recent years, immunosuppression-specific conditions may also be a cause. Let's talk about Crohn's disease. This is a type of chronic inflammatory bowel disease which can affect the entire digestive tract, from the mouth to the anus, although it usually affects the last part of the small intestine or the ileum, and some of the large intestine or colon. Its main manifestations are diarrhea and abdominal pain with stools, which may rarely contain mucus and blood. Complications include stenosis and or fistulae. From the point of view of Chinese medicine, this condition often corresponds to damp heat in the intestines. Next, let's talk about ulcerative colitis. This is characterized by ulceration of the large intestine, primarily the rectum. The main clinical manifestation include diarrhea with blood and mucus in the stools and abdominal pain. From the Chinese point of view, this condition often corresponds to damp heat and stasis of blood in the intestines. Toxic megacolon may be a complication of ulcerative colitis. Next, we have irritable bowel syndrome. This term is usually used in Western medicine in all cases of abdominal pain and alternation of diarrhea and constipation, which no abnormality may be found on sigmoidoscopy, colonoscopy, or barium enema. Being a functional disorder, many clinicians approach irritable bowel syndrome as a diagnosis of exclusion. The clinical manifestation include abdominal pain and distension and diarrhea, which often alternates with constipation. From a Chinese perspective, this condition often corresponds to stagnant liver qi invading the spleen. In neoplasm, this is a malignant cancer of the colon or rectum, which may cause diarrhea. This would be accompanied by abdominal pain. A red flag in Western medicine, special attention should be paid to acute diarrhea with bloody, as in dysentery, and or black tarry stool similar to coffee grounds. This condition requires immediate medical attention and diagnosis. Thank you for your attention.